everyone, and welcome to Science of First Take Science Town Hall. I'm Samantha Yammine, and I'll be your host for the evening. Together with some of Canada's greatest minds in health and science, we're going to dive deep, answering lots of your questions about viruses and variants, how we can stay safe as the seasons change, and how we can navigate difficult conversations while caring for our mental health and the health of those around us. Before we begin, I want to take a moment to for us to put our feet on the ground and acknowledge the land that we're on. Although we gather online this evening, it's important to take a moment wherever you are in the country, and we have people from all around the country and maybe around the world. For those of us here in what we now know as Canada, let's acknowledge the original homelands of distinct living Indigenous cultures. I'm joining you here tonight from Toronto, a city named from the Kanien'kehá:ka or Mohawk word Toronto, sorry. I want to give special recognition to the Haudenosaunee, the Wendat, Anishinaabeg, and the Mississaugas of the Credit, who've been calling this land where I am home for far longer, way before my parents immigrated here from Lebanon, and to all the First Nations, Indigenous, and Métis peoples who continue to live here. We encourage each of you to read the reports from the Truth and Reconciliation Commission. You can look that up at nctr.ca and learn more about the land that you call home by visiting native-land.ca. And that's just a starting point, but a great place to start to learn more about the cultures of Indigenous peoples in your community and to start supporting some of your local community groups. One of my favorites here in Toronto is Toronto Indigenous Harm Reduction. Find one nearby you, see how you can support, get involved, and learn more. Let me start off today by explaining a few of the options available to you for tonight's discussion. First, you have the option to turn on closed captions with the button on the bottom of your screen. You can also switch to French audio using the language option right beside it. We also have collected a series of questions in advance from our friends and followers on social media, but don't worry if you didn't submit a question or a new question has popped into your mind or you're inspired for a new question from the discussion, you can also submit a question that we'll answer towards the end of the session using the Q&A option. And our Science of First chat moderators are all health and science experts, and they're also going to be answering questions via text, answering as many as they can, even if we don't get to it in the panel discussion. Now, please join me in welcoming tonight's panelists. I'm going to tell you a little bit about them, and then we're going to get right into answering some of these amazing questions. First, we have Dr. Cora Constantinescu. She joins us from Alberta, where she holds a practice in pediatric infectious disease. From seeing vaccine-hesitant patients in clinic to her academic pursuits in vaccine acceptance and surveillance, she has a strong passion for vaccine research and promotion. She holds a master's in medical education and is a medical educator appointment with the University of Calgary, specializing in developing curricula and education programs rooted in psychosocial determinants of behavior change. She leads the 19 to 0 healthcare worker education team and continues to be a vaccine advocate at the local and national levels. What an honor to have you here, Dr. Cora. Thanks for being here.
My pleasure. Thanks for having me.
Great. And next we have Dr. Tyler Black, who joins us from British Columbia. I told you we're from all across the country tonight. He's a child and adolescent psychiatrist and suicidologist who's been in clinical practice for over 12 years. He was the medical director of emergency psychiatry at BC Children's Hospital, as well an assistant clinical professor at the University of British Columbia, and a researcher specializing in suicidology, psychopharmacology, and video games. He is the co-creator of HeartsMap, a psychosocial assessment and guidance tool for youth in emergency department, and the creator of the ASARI, or Assessment of Suicide and Risk Inventory, which is a documentation tool for clinicians who are assessing or noticing suicide risk. Hey, Dr. Tyler.
Hello, hello.
Hello, hello. Next, we have Sabina Vohra-Miller, who joins us from Ontario. She has a master's in clinical pharmacology and toxicology, and her list of credits in the science community is long, to name a few. She is co-founder of the Vohra-Miller Foundation, a philanthropic endeavor with the goal of making systemic, sustainable, and meaningful changes to healthcare in Canada. I've been doing a lot of work with that this year. She is also the founder of Unambiguous Science, which is a fact-based educational resource that aims to make science accessible and approachable. You can follow her on Instagram there. And she is the co-founder of the South Asian Health Network, a grassroots volunteer-based organization focusing on culturally appropriate health education content and advocacy to address structural inequities in healthcare within the South Asian community. Sabina's passions include both science education, especially countering vaccine myths and disinformation, as well as promoting and advocating for health equity and access to healthcare. Hi, Sabina.
Hi, thanks for having me.
Great that you're here. And our fourth panelist is the wonderful Dr. Janine McCready, an infectious disease physician at Michael Garron Hospital in Toronto. She completed her medical degree at the University of Toronto, followed by her internal medicine degree, and infectious diseases residency at the University of Toronto. She is the director of Michael Garron's Hospital Antimicrobial Stewardship Program and the Associate Director of Infection Prevention and Control. Since August 2020, she has led the hospital's school support team supporting schools and childcare centers across East Toronto. Hi, Dr. Janine.
Hi, thanks for having me.
Amazing. Welcome, everyone. Those are some impressive bios. I could barely get all those words out with all of these titles you all have. We are clearly very, very lucky to have all of you with your tremendous expertise from a range of disciplines here tonight. Without further ado, we got so many questions. I maybe 100, maybe more. I have no idea how many questions. We are going to try to get through as many of them as we can tonight. And if anyone in the audience wants to keep score of how many we answer, that'd be a really fun fact to tweet at us later. So we have questions from across the country. Now, we got a particularly large amount from people wanting to know how they can reduce risks for the upcoming holidays. And this weekend, some people may be celebrating Thanksgiving or gathering to have a meal with family. We had a lot of questions also about childhood vaccinations, mental health, and what's next. But let's start talking about the get-togethers, since that's coming up in a few days for many people. So Dr. Janine, can we start with you? Are there any new, this fall is different than last year. Things are different because we have vaccines, but can you tell us, are there any new best practices for gathering, especially with this upcoming weekend and maybe the later holidays this year?
Yeah, great question. Something I'm getting texted to me about 6 times a day in the last week. I mean, I think the things that I think about are what your local epidemiology is looking like. So where are you in the country and what are your case rates? So being in, Alberta versus being in the Maritimes, a little bit of a different situation these days. And, is the group that you're wanting to gather with all vaccinated, or is it a partially vaccinated group? Does anyone have symptoms? Is anyone sick? And then is there any exposures in the group? So if you have a fully vaccinated group and you're in a lower risk area, then please enjoy your holidays, have dinner. You can likely do that inside if everyone that's gathering feels comfortable. But if you have a mixed vaccinated group, and that includes, the kids that aren't eligible yet, and some are attending school, some are not, best to try and still have that outdoors, because we still know that outdoors is safer than indoors. And I think making sure that everyone that's attending is feeling comfortable with, the setting is really important. So thinking about, those types of things. And if it's mixed, try and move things outdoors, at least for a few more months until everyone that's eligible for vaccines can be able to get those. So those are the things that I think about when leading into this weekend. And then, in a few more months leading into Christmas.
That's great. That's a great summary. And I also know that the Public Health Agency of Canada has a pretty great guide that's color coded, you just follow the column to see which applies to you. If you Google vaccination guide, PHAC, Public Health Agency of Canada, you'll find it. And it aligns with exactly what Dr. Janine just said, of course. We had a specific question here. Dr. Cora, maybe you can answer this for us. People are wondering specifically, is it okay to hug family members if everyone is double vaccinated? Any thoughts on that?
It goes back to exactly what Dr. Janine said. So again, you have to see where the situation is at and in your local area, and also whether everybody is indeed fully vaccinated. And at the end of the day, you have to think what is important to you and how are you going to balance the benefits of being with people. To a lot of people, it's been a really, really, really hard year and a half, and that against the risk of illness, and also of those vaccinated people are some that are going to be more vulnerable to the disease if they get it. So do you have those elderly among you? Do you have people who may have cancers, who may just not respond to the vaccine as others? And in that case, then probably not safe to hug. But if you have young, healthy, fully vaccinated people, that is obviously a different risk than if you didn't.
Yeah, and mine, because I'm just, I guess I'm cautious and maybe a little paranoid. When I'm hugging my great aunt, I hold my breath or wear a mask. But you know what? We all do what we can.
The psychiatrist votes for hugs. I'm just filling that out.
I was just going to ask you, Dr. Tyler, we know how important hugs can be, and I think they can be relatively low risk with how Dr. Cora and Janine described it. Sabina, quick one for you. Is a negative test, rapid or PCR, enough to get together with my family, with my big family? We're all vaccinated. That's a direct question.
Yeah, that's such a great question. I mean, there's obviously limitations with any kind of testing, whether it be PCR tests or whether it be rapid antigen tests. But, doing one of these tests definitely does give you that extra sense of security that perhaps you can mingle with your vaccinated family members on a more comfortable basis. But I think it's also important to remember that with testing, you still have the possibility of testing negative being asymptomatic and testing negative, as well as, being symptomatic and testing negative, especially with the rapid antigen tests. So keep that in the back of your mind. I think that the risk of actually having COVID-19 despite being vaccinated is low, but still in the back of our mind, given the situation in many provinces right now in Canada, having a rapid test, antigen test, or a PCR test does not mean that you are 100% okay and safe to have indoor gatherings.
Yeah, I like to think of the rapid test as more of a brake rather than a gas pedal. They tell me, I definitely shouldn't, but I don't change my behaviors and do more things based on a negative result. But of course, a positive result would make me put the brakes. So I think thinking about it like that kind of balances exactly what you're saying. And then one more quick one about holidays. This is a really important one. If folks have symptoms, they should stay home, even if you're unsure. And I'm hoping this is a lesson. This is a take science for all of us, that if we are ever feeling unwell, we should think about whether we should be around others. Dr. Janine, can you just tell us quickly, does Delta have any different symptoms we should be looking out for?
So generally similar symptoms that we've heard about all along with COVID. So it can be as mild as a runny nose or a sore throat. And especially if you're fully vaccinated, it's unlikely you're going to get COVID, but if you do, your symptoms are often very mild. So if you aren't feeling okay, then, pay attention to your symptoms. So any cold or flu symptoms really could be COVID. So runny nose, cough, sore throat, headache, muscle aches, obviously fevers, and then that loss or taste or smell. We often, we see that with COVID, but usually that comes a bit later. So you're having those other symptoms, and then people will say, oh, wait a second, now I have that loss of sense of smell, and they'll go get tested kind of 5 to 7 days into their illness. So any of the, it's even me calling, thousands of people with COVID and seeing people in the hospital, I can't tell the difference between COVID and another virus by looking at you. So if you have symptoms, best to get tested and stay home and isolate yourself from others before you know for sure, until you're feeling better.
Thank you so much. I want to ask a few more about the holidays, then we're going to move on to some things related to recreational activities. So the next thing I want to say is, of course, if everyone's fully vaccinated, it's a relatively easy decision matrix, as long as you're not in a huge surge and everything. So if everyone that you want to gather with is fully vaccinated, not so difficult. But if there are unvaccinated kids, those under 12, not yet eligible for vaccinations, hopefully that changes soon, that makes things a little more complicated. And we had so many questions from parents, grandparents, aunts and uncles, everyone wondering how this all changes when you throw in multiple unvaccinated kids. Dr. Janine, you touched on it. So a specific one I want to get to is how risky would it be for an unvaccinated kid under 12, or babies specifically, let's say? So looking at the risk perspective for the kid themselves. Actually, Dr. Cora, do you want to touch on this for us?
Yeah, so a couple of things to unpack there. So children under 12 months of age are in our highest risk in terms of severity. So I know that a lot of parents of younger kids are really worried about the risk that others are going to pose to their child. Then there is also, of course, the other issue where if your child's a bit older in school, and if you are in a place like Alberta where the numbers are high, then your children could be the vectors. And we know that is for sure happening. So teenagers are most likely to bring it home, whereas younger kids are the ones, the most likely group to share it with their families. So we talk a lot about spreading the virus, but I also want to take a step back and say that even in a place like Alberta, where we're seeing high numbers, and where our vaccine uptake is not as high as in other parts of the country, the vaccine effectiveness is still high. Even with the Delta variant, we're 85% effectiveness. That's pretty good. And then against hospitalization and death, it's even better. So over 92% of our people in our ICUs are unvaccinated. So to those of us who do have 2 doses, take a breath of, there's a moment of relief to know that it's not the same situation we were in last year because of that. But you know, you're right, kids can bring it home and also there can be a risk to other kids. And it goes back to this same idea. Ask the questions around who are those vaccinated adults? Are you putting those highly vulnerable adults at risk when the younger kids are there? And similarly, if you do have a child who is a vulnerable child, such as a younger child, a child who may have underlying conditions, then again, there's the same risk kind of analysis that you have to do in your own family. You know, and again, to Dr. Janine was saying, the smallest little symptom is a big deal. In children, it's even a bigger deal because many of them can be asymptomatic and many of them can have very, very mild symptoms. So if your kid just looks a bit off, don't take them to that Thanksgiving gathering.
Thank you so much. And we're going to go to a video question shortly, but Dr. Tyler, I want to get your take on this. Just listening to all of these things, I know it can be very overwhelming for folks and very stress inducing to be the person who feels the burden of making the decision. That's probably the case for many people tuning in. Do you have any advice for folks struggling to manage this complicated decision and calculus we're all doing?
Sure. First, give everybody, you know, who's doing all this work, just give yourself a moment to appreciate how much information has come at you and how complex it's been. I mean, you know, this is a science event, and the science was starting from the moment this virus was discovered, and it's been evolving and messages have been changing. So yes, it's been a really hectic time and it's been really hard to keep up. But if you've been vaccinated and you're doing your best to follow public health advice, you are doing what you can do. The virus has some control that we don't. And one of the trickiest things we have in this world is accepting things that we can't control. We have to balance our own needs, our own healthcare needs, our own self-help needs, our need for camaraderie and family, connection, even touch. And there are other risks than the risk of the virus. And so if you're vaccinated, if you're doing your part to follow advice, you are doing your part. You have to make decisions at that point based off of what's important to you. And we try, you know, I've been hearing such great advice, and even in it, it sounds so complex. And if I was drawing a chart, it would be hard to follow, but you can follow your heart. You can follow your, you know, if you're following the public health advice on getting vaccinated, on watching out for those who aren't, the rest of it is kind of up to you and your value judgments.
Mm-hmm. Thank you so much for validating that and giving people that recognition that it has been hard and we have lacked a lot of control. And I think, as Dr. Cora reminded us, the vaccines work amazingly well. We definitely deserve a bit of an exhale at this point. Not that we can just pretend it's over, but we deserve a good exhale.
Not exhaling in front of each other's faces.
Yeah,
exhale
maybe
to the side.
exhale to the side. Do a little dab when you exhale. Let's hear from a video question from someone asking something about their grandchildren.
I have 2 very young grandchildren, 2 years and 7 months. The younger has Down syndrome. The 2-year-old gets quite excited when I visit and wants to hug. I do hug her, but I'm often concerned about the safety factor, although I'm fully vaccinated. Also, are there any specific measures that I should take around the 7-month-old, apart from wearing my mask and following the regular protocols?
Thank you for that question. Sabina, do you want to wrap up this section and respond to what we heard in that video?
Yeah, sure. I mean, what a great question. And, you know, I can tell you from my own personal experience, we go through these same questions here in our household as well. I have a 4-year-old. very close to his grandparents as well. And I think that, just referring to what Dr. Tyler talked about in terms of that the joy that you get from a grandchild and a grandparent hugging, there's something to it, especially when you're talking about going into year 2 of a pandemic. The precautions that she's taking are fantastic. Wearing a mask when you're in near your grandchildren is a fantastic idea. Again, the risk of someone actually getting infected with COVID after being double vaccinated is low, but it's fantastic that they're taking the precautions, especially for the 2 children who are at a slightly higher risk, one being because of age and the second being because of the Down syndrome, putting the child at a higher risk as well. So, in my opinion, that this grandparent is being fantastic in terms of making sure that they're keeping the 2 children safe. But I would also go ahead and enjoy the hugs.
Thank you so much for that. I want to get into a little more nitty gritty now, and it relates to that question we just heard. I want to talk a bit about transmission. There's some misinformation related to transmission, especially these days with all the booster talk. And I want to address that right off the bat. So I hear this all the time. We had some people wondering it in the questions. There's a lot of people saying on social media and everywhere that, oh, vaccinated people can spread COVID just as much as someone who's unvaccinated. So what's the point? Do the vaccines even work? Dr. Janine, can I throw this to you? Is it true that vaccinated and unvaccinated people spread COVID to the same extent?
No, definitely not. So if you're vaccinated, it reduces your risk in a lot of ways. So one, you're much less likely to actually get COVID. Then if you do get COVID, you're less likely to actually pass it on. So there's been some studies that show that perhaps your viral load is the same right up front, but your body likely controls it faster. So you're going to be infectious for a shorter period of time and less likely to pass it on. And then it's exceedingly rare if you're fully vaccinated to have severe disease. So not only are you going to be protecting the people around you, but you're also much less likely of severe disease. And there was actually some data just shared, I think, in the last few days here from Ontario, that it shows even out to 6 months, those vaccines are amazingly over 95% effective at preventing severe disease and even preventing symptomatic illness in fully vaccinated individuals. So it's they're not a bulletproof vest in terms of preventing everything, but they are extremely effective at preventing both infection and preventing your risk of passing it on to others. And that's in terms of a data point of view. But honestly, I've spoken to, again, so many families, and it's interesting because if you have a fully vaccinated person that ends up getting COVID from a close exposure, it's actually rare for them to pass it on even to their household members. Versus if you have an unvaccinated person as the person that is first gets it within their household, those people almost always pass it on to their family members. So it's very interesting. And so it plays out in the literature, but also in all the conversations I'm having with people on a daily basis.
Thank you. That's really compelling data for us to know for those of us very worried about those in our household and those vulnerable people in our lives. What reaffirming and reassuring, information to hear. Thank you. Dr.
Can I
Cora,
quickly add something very quickly to that?
Please.
So I was just reading this fantastic study that just came out, basically saying exactly what Dr. Janine said, but we have some data to show that in the first few days, the viral load might be similar in vaccinated and unvaccinated, but then there are actually studies coming out now to see whether this viral load, whether it's actually contagious or not. And exactly like what Dr. Janine said, those who are vaccinated actually have much lower contagious viral matter versus those who are unvaccinated. So absolutely, I think the literature and what you're seeing in real life completely matches in that way.
And I think that's where this rumor kind of started. I think there was one CDC presentation where they said the viral loads start similarly, but it was just one time point. And now that we're looking at a whole time course of viral load and actually trying to culture live virus, and we're seeing it's more neutralized from vaccinated folks. I think the way you two just described it, really puts that myth to rest. It is not true. Someone who's fully vaccinated is way less likely to pass along COVID than someone who isn't. So all the more reason to get vaccinated. Speaking of transmission and contagiousness, Dr. Cora, we had a lot of questions of people wondering how long children are contagious for, or is kind of that concern, I think, with the school and the holiday. Do you have anything to add on that front?
First of all, I want to say that we know a lot less about children and how contagious they are and how they spread it than we know about adults. But the easy answer is 10 days. If you have to remember a number, 10 is it. It does seem, however, that most of that contagion happens in the first week, up to 8 days. But the 2 to 3 days before symptoms is really a crucial period where most of the transmission seems to happen. So that's why it's so tough, because we're trying to say to people, don't go if you're even a little bit sick, because we know that even in that little bit of sickness, that bit of a headache, you're possibly contagious. So 10 days, but really it's more like probably around 8, but don't forget the 2 days before.
So with that, that just made me think of another question, and then Dr. Tyler, I'm coming to you. But Dr. Janine, can you tell us, based on what Cora just said, when should someone get tested? If there's this change, if it changes, the disease progression changes over time, when's the best time to get tested?
Yeah, great question. I mean, I think that the best time to get tested is as soon as you notice symptoms. So if you start feeling sick, best to try and go get that test as soon as possible, because then you're going to know right away. And if you get the test and you're negative and the symptoms resolve, wonderful, you don't have to worry. But if your symptoms do end up progressing and you're feeling worse and your test, for some reason did come back negative, it may not be unreasonable to get another test. In most cases, the test is very sensitive and it should pick it up if you get tested right away, because that's, your viral loads are, as Dr. Cora said, are kind of at the peak, kind of in the 2 days before and probably the 2 to 5 days after your symptoms start. So that's when really you should pick up the illness. But in some rare cases, it misses it. So if your symptoms continue to get worse, and you don't know what else it's caused by, not unreasonable to get retested, also depending on what's around you. So, but yeah, right away is always best, because then you can actually act on that and notify people around you.
Thank you. I want to talk specifically about some recreational activities folks asked for really quickly. Let's go to a video question.
I'm 6 years old, and my question is, how do I stay safe in Taekwondo?
I love that question. Sabina, do you want to jump on that?
What a sweetheart. What a sweetheart. And, I think that first of all, I have to say, what an amazing child to actually be asking these questions and having that, in the back of their mind on how to keep themselves safe. I think that's just so incredible. I think that if a child is in Taekwondo classes and if it is indoors, the best thing to do is be masked and make sure that the mask is not just a good quality mask, but is also fitted well as well on their face. I think that's incredibly important. The other thing that parents can advocate for is to ask and ensure whether the instructors and other staff are vaccinated within the center as well is incredibly helpful. And lastly, but not the least, improving ventilation is so critical and crucial. And again, this is another avenue where parents can advocate for improving ventilation in any indoor settings, whether that is, through HEPA filters, through MERV filters, or through, portable HEPA filters as well.
You actually answered a few. There was someone asking, do good quality masks protect me? And yes, they do, especially if they're fitted in multiple layers, as you said. And another person asked, would you recommend vaccinated people wear a mask to an event in a place where vaccine rates are low? That's a great idea. And same if you're unvaccinated, even more reason to wear a mask. So you answered a few questions in that. Dr. Tyler, I saw you raise your hand for a response to that.
I just wanted to point out, one of the big pieces of misinformation and one of the politicizations of sort of what's been happening in this pandemic is wielding children as foils in our political battles. I work with children every day. They get it. They want to help their fellow person. They care about their classmates. They care about their grandparents. They care about their parents. They are amazingly empathic and generous human beings who understand that the little things that they do make it safer for other people. I think one of the big pieces of misinformation we have out there is that children are suffering because of these things that we're quote unquote making them do, when in fact, when they understand why they're doing it, they're more than happy to do it. I've rarely met a child who spontaneously develops an anti-vaccine or anti-mask position when it's presented to them. This helps other people. And I hope we can learn a little bit something from our little Taekwondo master there, because that's a great mindset to have. How do I protect other people? How can I stay safe?
Right. I just love that question. I think I remember seeing a survey. I can't remember. I'm sorry, I'm not citing my source here, but it was like, ask kids what their least favorite rule to follow is in school, and not being able to talk in line was number one, and wearing a mask was like they didn't care.
Way down there, way down there.
Dr. Tyler, I wanted to ask you a question on doing more recreational activities. Someone asked, I'm fully vaccinated, but I still feel anxious in crowds. How can I cope with my anxiety? I'm also taking notes for this one.
Yeah. I mean, it's a different world. You know, I even look at old concert videos, or I went to a Lakers game right before the pandemic hit, and imagining myself being in an arena with 20,000 people at this moment is hard to do. It's going to take us time for us to get used to how our brain responds to the assessment of threat. I would always try to remember that one of the reasons our brains feel anxious is because there's stuff we can't control. So do what you can. The stuff that, you know, Dr. Cora, Dr. Janine, Sabina have been talking about has been things that we can do and things that we can control. Ultimately, we also have to live our life, and we have to give ourselves a break. This is hard. This is where we need to lean on our supports. We need to make sure that we're expressing how we feel. We don't need to be brave for other people. It's okay to show our weaknesses and our hesitancies. And you know, being performative in our braveness doesn't help anything. And then just admit that this is tough. Give yourself a break. You deserve that extra sick day if you can take it. You deserve that extra cup of coffee. You know, you if that's what you need to get up in the morning, you know, just give yourself a break.
Thank you so much for that. It takes time, it takes practice, and we should all go at our own pace and set whatever boundaries we can. I want to do some quick, we had some very specific activities folks asked about. So Dr. Janine, can I get quick answers to these specific things? Should I share indoor space with an unvaccinated person without a mask on if I'm fully vaccinated?
I would still recommend wearing a mask, even if you're fully vaccinated. If you got COVID, you know, you would be exceedingly unlikely to have severe disease, but you could still get it and pass it on if there's other unvaccinated people around you. So still a good idea at this point to wear a mask.
What about taking vacation abroad? Back to you.
So,
really putting you on the spot here.
I've been thinking about a lot about this, and my husband every day is like, so when can we go on a trip? Maybe not every day, but every other day. I think it depends again on, you know, on you, if you're fully vaccinated and where you want to go. So I think that, you know, those are the decisions that I make. You know, within my family, my children are still not eligible, but once they're fully vaccinated, my whole family's fully vaccinated, we're going to look at places that have a higher vaccine rate, that have good policies about, you know, what their vaccination rates is, how they control COVID in those countries. And then likely I'll feel safe to travel to those places, right? Because when we get to a place where everyone that you're traveling with and everyone you love that you're going to be with is fully vaccinated, it turns COVID, which is potentially this deadly, terrible virus, into a cold. And no one likes to have a cold, but then it's not a big deal anymore. So I think that, you know, for me, those are the things that I'm looking at and when I can travel. If I was a single adult that never saw anyone that was unvaccinated, you know, I potentially would go on a trip now to a place that had low rates of COVID. And I think traveling in Canada versus traveling abroad, those are, you know, two different questions too, because you have to look at, you know, what happens. I think happens if you do end up getting exposed and you end up having to be isolated, and how does that impact your job? And so if you work from home and you don't have to be around vulnerable people, then that makes that decision easier, versus if you work at a hospital and you're an ID doctor, I've got to be a little bit careful about when I decide to take off on a trip.
When I saw the proof of vaccination announcement for anyone boarding a plane in Canada starting October 30th and with no exemptions with testing November 30th, I started looking up some stuff. Definitely. A quick one for you, Dr. Cora. And we've talked about it a lot, but someone asked specifically how safe is going to an Oilers game?
About the same as everything else. So you have to think of that risk and where you are. Is it a place where they're requiring that people have a vaccine passport to go to the Oilers game or not? Is it, what is the risk considering the people around you and your own personal risk? So who are you? Are you somebody who may be a vulnerable person? In which case, I think you have to think twice about it. And then maybe it goes back to that, how do you manage your anxiety around big crowds that Dr. Tyler did such a good job of describing? It drives me bananas when people say this, but it's a personal decision at the end of the day. I do think, however, that if you are going to places where they are requiring a vaccine passport or where vaccination is mandated, that changes the game. And I say that with a bit of a pun intended. It changes the game in terms of the risk that you are putting yourself at.
I just point out the Oilers aren't really worth it. If it was a Canuck game, it would be something, but
I think somebody take him out right now.
Put him in the waiting room. Thank you so much for that. Okay, Sabina, I have a question for you. We have a lot of people wondering about why we're not looking at people who've had prior infection, and why, when it comes to things like vaccine mandates, which are popping up in different provinces in different ways, but how come someone with prior infection isn't really counted in some of those systems, and others they are?
Yeah, that's such a great question. So I think the bottom line here is that having a prior infection of COVID, unfortunately, does not mean that you will have a robust, long-lasting immunity. So in some cases, yes, you may have immunity, but in many cases, you may actually not generate consistent, and robust immunity against COVID. And in fact, there was data that came out from a CDC study again that showed that people who were unvaccinated and had prior infection with COVID had a 2.3 times higher risk of being reinfected with COVID compared to those who were vaccinated. So, looking at that data, what we have to see is we have to understand is that being vaccinated is still really important, even if you have had COVID infection in the past. Now, the one question that we're still trying to get better data and answer for is whether you actually need a complete series. So at this time, NACI, which is the National Advisory Committee on Immunizations, still recommends getting both doses of your vaccine, even if you have had a previous infection with COVID. But there is some data that shows that having even one dose of the vaccine after prior infection does still mount a really good good robust immunity. So I think over time we'll have more data on this question as to whether those with previous infection will really require both doses or not. But again, it comes down to the fact that we don't necessarily know if someone has indeed had a previous infection of COVID. We don't really know if they did mount a really good immune response to the previous infection either. So at this point, the recommendations are still full series of vaccination, even if you have had a previous infection.
And Sabina, I'm also just on that note, so prior infection, you should still get vaccinated. Are there any known medical exemptions for COVID vaccines?
Yeah, so at this point, there's really two that are highlighted in terms of medical exemptions. And again, they're not necessarily fully straightforward exemptions per se either. So first of all, if you have had dose one of a COVID vaccine and you have developed myocarditis, which is inflammation of the heart muscle, or perimyocarditis, which basically is or pericarditis, which is basically inflammation of the membrane of the heart. In that case, the current recommendation is that you wait for getting dose 2 until we have more information specifically on myocarditis and pericarditis. But if you have had, say, for instance, a previous history, and I'm getting this question a lot, what if I had myocarditis 5 years ago or 10 years ago? Speak to your doctors, your specialist team, because that's not necessarily a reason for you to not get the vaccine at this time. And second is people who have had an anaphylactic. So an anaphylactic reaction to a COVID vaccine. And anaphylaxis really is a multi-system reaction that necessitates the use of epinephrine, so your EpiPens. In such situations, again, the guidance is to speak to an allergist, because there are fantastic allergists across Canada who have these high-risk clinics where they're specifically looking at people who have had reactions to dose 1 and how they can actually go ahead and have dose 2 safely. So even in these situations, the recommendation really is to get a referral to see an allergist who can help you guide with this. But really, those are the two key medical exemptions that exist right now for the vaccines.
Dr. Cora, anything to add to that?
No, that's exactly, that's great.
Excellent. So I want to make that very clear that there are really just those two.
As a psychiatrist, I concur.
Yeah. Do we have consensus amongst the whole panel? Dr. Janine?
Agreed.
Wonderful. Thank you so much. I love that. Let's go to our final video question, then we're going to take some questions from the audience.
Hi, my name is Andrea. I'm from Vancouver. My question today is, how do I encourage or support a loved one who is resistant to getting the vaccine due to mistrust of the government's intentions or the pharmaceutical companies that are involved, as well as fears of long-term effects? I would love to know how to gain some tools to support that person and encourage that person towards moving towards getting a vaccine. Thank you.
Really good question there. Dr. Tyler, can you get us started? How do you have this conversation with someone who is distrustful or mistrustful of these institutions?
It really depends a lot on how locked in this is, where your success is going to lie. I think the first thing you'll see a lot about vaccine mandates and requirements. Leave the enforcement of vaccines to governments and public health. Make your own personal rules. But nobody gets convinced by judgment. Calling someone names or being judgmental about how they perceive things has never convinced a soul of anything. And so I'd avoid coming from a judgmental position. And that starts with, what are your concerns? Let's look this up together. I've heard that, but then I also saw this other site that said it was misinformation. And we know that debunking works. If you know what the person is specifically worried about, if you can answer that or allay that or talk about your own experience, it can really help. What we also know is that people who are less inclined by the science, which universally supports vaccines, if someone is less convinced by that, they might be convinced by a personal story. So share your vaccination experience, share how it went for you. Even if you had a mild symptom, I had a sore arm for a day myself. I would just say, yeah, I had a sore arm, but it was pretty nothing else. And I've even been in conversations where I've convinced some family members to be vaccinated. So listen, don't be judgmental, find out what their specific concern is and address that. And I wish I could provide a better map than that, because it's going to be really varied. Don't try to butt heads with people who are 100% convinced of what they're going to do. It's not worth the effort, and it's not something that people have avoided harm over. So I would say it's not worth your time.
Thank you. And Dr. Cora, I want to hear from you too, and also combining with an audience question we got live during the session. Someone was asking, how do you respond to a vaccine hesitant family member that's concerned about the long-term side effects? And that was in our video question too. So if you can address that specifically, people concerned about long-term effects.
So I like it when people ask questions about how to address family members, because I think the first rule on communicating around this vaccine is to connect before you can communicate. You need that common ground, because that's where trust is. And we now know more and more research shows the messenger is more important than the message. So you don't need to be a vaccinologist to be a vaccine champion, because you can still pass this information because you've connected with them. And the next part, especially around long-term effects, is show true curiosity. And that's really hard. And I try that as a parent, and it's really hard with my kids. But it's hard not to pass the judgment with the question. So just like Dr. Tyler said, tough to be non-judgmental, and you have to practice it. We have to say so when people talk about long-term effects, and I believe that the long-term effect issues come around two things. So one, parents always think of long-term effects for their kids. That's why we tried not to let them, screen time and so on, other we're always successful. And second of all, I think it's a bit of an armor for people who are vaccine hesitant, because they know that we're going to say, well, we don't have enough long-term, studies, therefore we can't answer your long-term effect question. But I always say, well, what is it coming from? What's the fear here? What are you truly worried about? Is it infertility? Is it like, what is the long-term effect? So show that true curiosity. And then always help them frame the vaccine within the context of their lives. So if this is a single mom worried about long-term effects on her, then help them frame how a hospitalization, if she ends up hospitalized, is going to impact her family. So again, and this is again where you share your story, like Dr. Tyler said, and help them frame what this means for their lives. So connect before you can communicate, show that true curiosity. Before you jump in and talk about long-term effects, try to truly find out what it is that worries them about that. And then it's always about a personal decision. They're just trying to make the best decision they can. They have to do it in a personal way, not in a philosophical debate kind of way.
Thank you. Sabina, you want to add?
I do want to add, and I actually want to add specifically from the perspective of the racialized community, because it's one of the things I hear very often from the South Asian community with respect to vaccine hesitancy. And I think what we have to do sometimes is just take a step back and acknowledge, first of all, that in Canada, we do have a long history and legacy of racism, discrimination, and experimentation in many of our communities. And there is a valid reason for distrust that can exist with governments and healthcare systems. So the first thing when I have someone from my community, tell me that, how can I trust that this is actually being done for my benefit and for my good, because I have, this long history of racism that I've experienced in healthcare. I can't gaslight. I have to stop and I have to acknowledge, and that is so incredibly important to do. And the other thing is, trust is not rebuilt in a day. Trust takes a really long time to build back, and so the expectation that having one conversation with someone will, generate trust overnight is just it's just not feasible. And so really having that open line of communication is so important, because you have to keep building to get to a place where they can trust you. And this is where BIPOC organizations play such a huge role, because having someone from within your own community who looks like you, who speaks your language, is so impactful. Because again, like Dr. Cora said, it is about the messenger very often. I've done a lot of vaccines education sessions for the South Asian community, and I could talk for 2 hours about vaccines, but at the end of it, they will ask me, but are you vaccinated, or are you going to vaccinate your child? And that question alone is so much more powerful in actually building trust within our communities. So I just wanted to take a step back and acknowledge the fact that indeed communities that have been marginalized, and communities that have experienced this legacy of racism in healthcare, we have to take a step back and acknowledge this has occurred.
Thank you for adding that, Sabina. Speaking of, we've talked a lot about COVID vaccines, but and I actually should say that question came from Barb Eagle. So thank you, Barb, for that great question. We had a question about another type of vaccine. Dr. Janine, I was going to ask it to you. And this is coming from Michelle, wondering, I'm double vaccinated for COVID. Do I need to get a flu shot?
Yeah, so great question. So, last year, we were very fortunate to not see very much flu. I think this year, we're really not sure what to expect. We certainly have seen lots of different viruses already circulating with, schools more open and activities more open. And we do expect there will be some flu circulating. So definitely a good idea to get your flu vaccine, and it won't interfere in any way with your COVID vaccine. So, go ahead and get it. And fortunately, NACI, so our agency, they just they reviewed the evidence again, and they have said it's fine to get your flu vaccine, even if it is, within if you haven't got your COVID vaccine yet and you decide to go get them both, if they're offering clinics, then that's fine too. It won't interfere, and definitely a good idea to get that to prevent the flu this year too.
Thank you. Now we have about 5 minutes. I'm going to try to get through a few more questions. This one is for you, Dr. Tyler. Do you have any resources you recommend for mental health support when accessing therapy is so hard? So this person's saying they've been facing months of wait lists. It's a tricky one, but
yeah, it's tricky, without knowing their jurisdiction. Every jurisdiction will have child and youth mental health teams, adult mental health teams, support services. There can be niche support services, so survivor groups, addiction supports. So it really depends where you are. Social workers and healthcare organizations, like a healthcare clinic in your community, is a great place to start. We also have to recognize that there's a lot of lip service that was paid both in this election and generally to we need more mental health supports. We really do need more mental health supports. I'm so glad mental health is one of the focuses of this pandemic, but we need to carry this advocacy forward. It's very realistic to be put on a wait list with a non-urgent, non-crisis mental health problem. And we have to acknowledge that we have poor access to psychologists and therapists and these types of things in Canada, despite universal health care. Mental health is our health. These things are directly related. Our physical health goes as our mental health goes. So keep the pressure on. It unfortunately requires being a squeaky wheel in Canada. So I would encourage being a squeaky wheel and access a health clinic, and don't accept wait lists if you need help now.
And just to follow up, because we did get quite a few questions about mental health, and we're glad to have you here. Is there anything that parents can do at home to support their kids, especially while they're waiting for that vaccination for the under 12s?
Well, I've been talking a lot about giving kids a break during the pandemic. It's a very stressful time. School is important. School is not that important. If a child had cancer, if a child had any other issue going on, we would say, treat your cancer and we'll deal with school later, or, stay home, you have a broken leg. In the same way, if you're struggling, it's okay to take the gas pedal off. And I really encourage parents to not come up with the solutions for their children's problems, but listen to what their children need. If they say, Mom, I'm having a hard time with school, son, how can I help you with that? Is there anything I can do for you? Because parents can kind of go into helicopter mode and solve everything, but not really be listening to what their kids say. So keeping an open ear and recognizing that school is an extra stress right now. It's a great thing, but it's very stressful. Kids do not miss school generally. It's parents that miss the availability of school. So take the pressure off if you can.
Thank you so much for that. And I have two last questions. The last one I'll pose to all of you, but this second last one to you, Dr. Cora, just quickly on treatments. I realized we didn't cover that. And we had some people wondering about ivermectin and about molnupiravir. Did I say that right? If you can just quickly tell us, should we just wait to get those treatments instead of getting vaccinated, or are these treatments even helpful?
So ivermectin is not, and I think Dr. Janine actually treats probably adult patients with COVID and could answer this very well. But ivermectin has been shown to not actually be helpful in COVID. Now, there are some promising what they call monoclonal antibody treatments for COVID and some newer drugs, but those are not they're not miracle cures, and all of them and they're not without side effects. I find it interesting that people who are against the vaccine would be pro getting antibodies from thousands of people put into their bodies. So I wish I had a different answer, and I wish I could say, yeah, we got it, we have the cure, but it's actually a little bit depressing for me that even a year and a half in, we don't. The best way to prevent this and to protect yourself is to get the vaccine.
Dr. Janine, you can add a quick comment on that.
Yeah, I mean, it would totally echo what Dr. Cora said. And I think the other important point about these, potential new treatments, the new Merck drug, we don't have much data at all yet. There was a preprint out, looks promising. But I think the thing we'll see with all of these treatments is they have to be given really early. So, even if you're, by the time I see people usually coming to hospital, they're having shortness of breath, they're struggling to breathe, and that's why they seek treatment, it's too late for those medicines at that point. So even if we start to see these treatments, which I really hope we do, they're nowhere near as good as a vaccine, because the vaccine can prevent you from being in that situation. And so, and same thing when you have people, it's very hard to have those conversations when they're struggling and they want anything for their relatives, and all of them just wish they could go back, back in time a few months and be able to convince their family members or themselves to get the vaccine so that they can hug their parents, one more time.
Thank you so much for that. I think it's very clear everyone on this panel deeply cares about everyone, and really just wants this whole pandemic to be behind us. At the same time, our doctors are here to treat you regardless. Our mental health experts are here to support you regardless. We're here to give clear information regardless, regardless if you're vaccinated yet or not. It's important for people to know that you're the people doing the work every day, and you do deeply care about everyone, and you're just trying to help make this better for everyone as soon as possible. I think that message has been lost a little bit over the last year and a half, and I really want to acknowledge all the work that you've all been doing. Thank you to everyone who submitted questions tonight, and thank you so much to our experts. Before we close and go to Senator Stan Kutcher, I want to ask you all one last question. As scientists and healthcare professionals who are also living through this uncertain and difficult time, can you share with us what coping strategy you're taking with you into fall and winter? Just quickly, what's the thing that you do, Dr. Black? Or Dr. Tyler, sorry.
I've gotten into astrophotography, so I take pictures at night just by myself, which is the best COVID activity in the world. And I've focused a lot on reprioritizing my energy. Some things I've put down because it's been a stressful time.
I love that. Thank you. Sabina, how about you?
Here are things that I try and do. I'm not very successful in doing them, but I hope to do more of. So first of all, decompress from social media. Just get off social media, get off all of the noise, and take some time out from it. And then spend that time really with my family. My 4-year-old, my dog, my husband, my father who lives with me. One advantage of these times is just having a lot of family all the time with you 24/7. So might as well take advantage of that and get some extra hugs in.
I love that. Dr. Janine?
I think two main things. One is to really try and, I think as Dr. Tyler said, it really resonated, like do things that you feel like you have control over. So, there's still a lot of work to be done where I am and in the work that I'm doing. So I try to focus on making things better for the people around me. And so if I can even get through to a few people and convince them to get vaccinated, or if I can make testing easier for people, or, whatever, all of us have kind of a role to play. And so I feel like that gives me some purpose and it helps me to get through this. And then in the time where I'm not spending every hour at work, getting outside and just going for walks with my kids and trying to reconnect with them, because it's been a tough year for all of us. And I think that, appreciating those moments, and that I'm really lucky, and we're all really lucky, despite everything we've been through, that, things are really hopeful, and really every month and every day from now on should get better. And once we get the vaccines for the kids, everything, we shouldn't be in the spot where we're in for much longer, really.
Thank you. And Dr. Cora?
Well, I tell you, there are days when sometimes it feels like it is really hard to cope. I've got 3 kids and a husband and a job, and I love them all, which I think is helpful, but times can be really tough. So what I've gotten to doing is a pep talk. So I shall share my pep talk with you guys. As a vaccine advocate, I say to myself, your job is not to convince people, it's to support people as they make the decision to protect themselves. And that makes it feel less helpless and less hopeless, because even though this is really hard, looking out for people is the right thing to do. So my coping strategy is a pep talk that hopefully gives a little bit of hope in my heart as we move forward, especially vaccinating children, which I think is going to be a really tough few months.
Thank you so much for sharing that. I'll share mine super quickly. I watch Drag Race And there's a new season of Drag Race Canada starting, I think, in a week or two. So get into it. Thank you all. This has been so great. Sabina, Doctors Tyler, Janine, and Cora, your expertise and insights. I could talk to you for hours more. We got through quite a lot of questions, and there are more, I'm sure. But thank you, everyone who asked questions. Thank you all for your expertise on behalf of the team at ScienceUpFirst. I hope everyone who tuned in feels better informed and inspired to take science with you as we look ahead to fall. And we hope that you'll take a minute to share some feedback with us as well at the end of our time together, which is not over yet. We're going to hear from Senator Kutcher shortly, but you will be prompted at the end of the session to respond to our brief post-event survey. We're offering a special giveaway to the first 5 people who complete it. So fill it out right away because you could get a treat. And thank you for sharing your info with us. It really helps us to continue doing these events and make them better and better each time. So with that, thank you to our panelists. Thank you to all of our organizers as well. And please join me in welcoming Senator Stan Kutcher live from Nova Scotia, who will close us out this evening.
Well, thank you very much for this opportunity to participate. And we have a new puppy, so enough said, and 7 grandchildren, enough said. So there we are, that's the focus. And thanks to ScienceUpFirst for putting on this event, a tremendous expert panel and a very skillful Science Sam moderator. And I learned a lot. I was also very impressed by the breadth and the depth of the questions, which illustrate both what people want to know and what they're concerned about. And I think that that is so important, that people have this opportunity to talk to people who are expert in the field and get those questions answered. And ScienceUpFirst is taking that very seriously and making this opportunity happen. You know, the last time we as a globe were faced with this pandemic was over 100 years ago. And there were about 100 million people, as far as we can tell, died from the flu at that time. And one thing that we learned from that pandemic, and we are relearning, it's sad how human beings have to relearn truths, but we're relearning from this one, is that the spread, but also the stop of the pandemic is based on the behaviors of people. How people behave will either push the spread or will put the brakes on it. And so all of us have to take ownership of that responsibility. We all have to take ownership of that behavior. And that means not just ownership for our own health, but the health of others. Because by our behavior, we can actually spread an illness that may have people die from it, that may have people severely affected in the short term, but also, as we're learning, in the very long term. Also, if we get ill and go into a hospital, we can block access to intensive care beds that other people also need. So taking that responsibility for ourselves, for our behavior, because it's by that behavior that we can put the brakes on the spread. But also collectively, our governments have to take the responsibility to do what is necessary. Sometimes those are very difficult decisions, very difficult, as we're seeing, but they have to take that responsibility. But also institutions, such as universities, they have to take that responsibility. Businesses and organizations, be they religious organizations, cultural organizations, or others, because they also have skin in this game, and they can help influence the behaviors of their adherents. And in order to know what kind of behaviors we have to do, we have to understand and seek out the best available science. Because without that, we can't discharge that responsibility, either as an individual or as an organization. You know, we are all in this together, and we will all pull through this together. But in order to do that, we have to stick to the best available science, and we have to connect, and we have to communicate with each other. So we really know what to do. Get vaccinated, follow public health advice, and be kind and compassionate to others. Take people by the hand and see if we can lead each other to where we need to be. And I just want to close this with a suggestion for changing our cognitive narratives, changing the way that we are looking at what we are facing, instead of as a problem that will defeat us, to a challenge that is demonstrating that we actually have the ability to adapt. Now, one of my favorite quotes is from Roosevelt, and he said, "A smooth sea never made a skilled sailor." I think it bears repeating. A smooth sea never made a skilled sailor. And right now, our seas are not smooth. But we're going to come through this, and we're going to come through it with all sorts of skill sets that we can then use for other things in our lives. You know, human beings are by nature resilient. So we have to promote that resilience, but also realize that some people amongst us are living in circumstances which get in the way of them becoming more resilient. Those that live in poverty, those that are racialized, some indigenous populations, people who are struggling. Those are the people we really need to focus our attention and effort on to make sure that they have the same opportunity to be successful in their resilience. It's not just those of us who are privileged. I want to end this with a quote from an article in The Atlantic, which was written by 3 of the world big researchers in mental health on the mental health effects of the pandemic. And the article is titled, "The Pandemic Did Not Affect Mental Health the Way You Think. The world's psychological immune system turned out to be more robust than expected." And I quote, "Human beings are not passive victims of change, but active stewards of our own well-being. This knowledge should empower us to make the disruptive changes that our societies may require, even as we support the individuals and communities that have been hit the hardest. We're going to come through this. We're going to have learned, and hopefully we're going to put that learning to good practice as we walk into the future." So thank you to everybody on the panel. Thank you, Science Sam. Thank you, ScienceUpFirst, and thanks to all of you who participated. Have a good evening.